Atlantic Fellows around all week. The reason for doing this partly is so that you can see people and get to meet them in the reception and all that follows. Do make time to say hello. This week is all about connections. It's all about connecting people together. It's all about who's in the room. How are we doing for time? We're doing very well indeed. So, so we have different groups here this week. We have the Atlantic Institute people. We also have this extraordinary group of people who we call by three names. We call them the Jameel Arts and Health Lab. We call them the Lancet Special Group, and we call them the WHO Group, because in a way they connect across all of those organizations. They are extraordinary academics and researchers, practitioners in their own right, and what they've done, they're going to tell you about. So I'm not going to do that, but what I am going to do is there is one tune which is universal in the world, and it's Happy Birthday. And one of the people in this room, Nisha Sajnani, who's about to speak, it is her birthday. So can we sing Happy Birthday to Nisha? 1, 2, 3. Happy birthday to you. Happy birthday to you. Happy birthday, dear Nisha. Happy birthday to you. That should get a big one. So I didn't put you on stage and do that. I did that before you came up. Would you like to come and join me on the stage? We're going to be joined by extraordinary people, and it changed in the afternoon, which is fantastic. So let me try and organize myself. So we are joined by Nisha Sajnani. Nisha is the Director of Program in Drama Therapy and Theatre at the Health Lab in NYU, New York University. And New York University have been fantastic in supporting all of this group to join us. She's also co-founder of the Jameel Arts and Health Lab. Next up, Stephen Stapleton. Hey, come to the stage, Stephen Stapleton. Co-founder of Jameel Arts and Health Lab, also of Edge of Arabia and Culture Runners. Amazing projects. Look them up, they're fantastic. Jill Sonke. Jill Sonke was here last year. We could have put her in there before last year. Jill is a leading researcher in all sorts of arts and health aspects. She's primarily at the moment the Director of National Impact and Research for One Nation, One Project, which you talked about a bit last year, and also Research Director for Center of Arts in Medicine in Florida. And we are joined by Daisy Fancourt. Daisy Fancourt is the fabulous head of behavioural group in University College London and has many, many, many strings to her bow. So I'm going to get out of the way and leave it to you, I think. And then we hope this all works. Thank you. So great.
That was beautiful singing, and what a gorgeous surprise and very unexpected, and I feel very warm and welcomed back. Last year, we were on this stage speaking a little bit about the Jameel Arts and Health Lab. My colleague Neil Sfichte, who's another co-director of the lab, like a proud dad up there taking photos of all of us, just loves me. Spoke a little bit about a policy brief that we'd created around the role of the arts in supporting the mental well-being of forcibly displaced persons. There's some great through lines, with some of which has already been presented here today. So we're going to tell you a little bit more about what the Jameel Arts and Health Lab has been doing over this past year, the first year since its launch, and our colleagues, you're going to introduce each of yourselves in more depth when you come up here. I'll just mention briefly, I'm joined on stage by fellow co-director of the lab, Stephen Stapleton, and two members of our steering committee, who you've also heard introduced, Jill Sonke and Daisy Fancourt, also from the Jameel Arts and Health Lab, as well as from the other spaces that they occupy. So again, telling you a bit of a story about what the Jameel Arts and Health Lab has been up to, and then we'll pass it over to Jill and Daisy to provide some concrete examples of what this work can look like at a local level, at an international level. And then we're going to tell you about a specific project that we've been working on with other researchers who are here with us as well, in collaboration with the Lancet. Right. So, Stephen, I'm actually going to call you up to tell us a little bit about the lab. Again, the lab has a mission to measurably improve lives through the arts and accelerate implementation for those interventions for which there is good evidence across 193 UN member states. And we're able to do that because of the collaboration that we have with the WHO and, of course, with many wonderful labs around the world. And Stephen's going to tell you a bit more about the model of the lab since our launch.
Thank you. I printed out some notes, but the font's far too small and I can't read them. So I'll just go there. And I want to thank Dominic. It's my first time here at Creative Brain Week, and happy birthday to Nisha. I've got 2 minutes to go through the model of the lab. I'd also like to thank Aer Lingus because I missed my flight this morning and they had the perfectly timed flight to replace it that I could get here on time. So thank you to Aer Lingus. They've left it to the artist. I'm actually in charge of the communications and the artist side of the lab to talk about the structure. I'm not sure why. But this is a sort of very simple diagram to show you how the lab works. It's really about trying to break silos between the three different communities, the research community, of which is represented by 3 of the finest researchers here, the outreach community, that's really the storytelling community, the community that makes films, journalists, convenes events like this. And we really believe that with rigorous research, which is the foundation of the lab, ambitious research, as Daisy encouraged us at the beginning, experimental research at the heart, that's great, but if you can't tell the story, if you can't tell the human story through the outreach, then sometimes it's not enough to convince the policymakers, the leaders, to actually change the system. So we ultimately in the lab, as Nisha said, are looking to influence ministers of health, ministers of culture in 192 member states through the model. So nothing if not ambitious. A little examples of some of the things, an expression of what we do. This was actually the event where we launched the Lancet series, which we'll talk a little bit about later. What's interesting about this is it's an opera singer hosting a well-being concert at Carnegie Hall for policymakers during the UN General Assembly. So the entire audience are those people that are normally just focused on the politics of things, and we thought how interesting to have them as an audience to actually experience what arts and health is. And what we found is actually when you invite policymakers and researchers and artists together, they're all kind of excited to meet each other. The policymakers are thrilled to meet the artists, and the artists think the researchers are so amazing and impressive, and we've seen some real success. Here are some more examples of our events last year. One thing to point out is it's still the 75th anniversary of the WHO. It's a year-long celebration which ends in May. So this event is part of WHO 75. We hosted the big concert in Geneva last year. There's Nils, who I think is speaking sometime this week, who's another director of the lab on the music and motherhood convening. And this is this year's schedule. So we're so delighted. This is our first kind of collaboration of the year. Thank you again, Dominic. And we have a lot of global activity this year, which will end in COP29 and certain sort of global policy events. And maybe just to end before handing back to Nisha is to just refocus on the ambition, I think, of all of us to change the system and to get the attention of policymakers. This was an example of a Healing Arts Arabia Week last year, where we were invited to look at the Arabian Peninsula as a region, and we did a group of convenings, but very quickly it caught the attention of the Ministry of Health, and they invited us for the first roundtable, which is now having a knock-on effect and will turn into a multi-year engagement with ministries in the region. This is Chris, who many of you know, the 4th director of the lab. So I hope that was something of an introduction, and I'll hand back to Nisha to talk a little bit about the global research before Jill says a few words. Thank you. Was that more than 2 minutes?
Great. We're going to be launching a new website soon, so if you go to Jameel Arts Health Lab, you'll see one that we've just had up over this last year to say a little bit about what we're doing, but we hope to have a new one up soon, and it'll be covered in maps like this one, and it'll show off a bit of the outreach schedule, where things have been happening, including events like this one, events that we're directly involved with, but also events that other partners are involved with, and where they're mobilizing conversations and activity, uniting, integrating the arts and health, as well as tremendous research in this area. And we're working both at a hyper-local level with our partners as well as at a hyper-international level. And to really put flesh on that, to really speak to that, I'm going to pass this over to Jill Sonke and then Daisy Fancourt, who are going to share with you some of the research that's been happening. Jill.
Thank you, Nisha. I was delighted to be here at this amazing event last year and talked a little bit about One Nation, One Project. And as Nisha referred to, this is a beautiful example of hyperlocal to national. One Nation, One Project is a national arts and health initiative in the United States designed to leverage the power of arts and culture to significantly advance health and health equity and social cohesion in the United States. So it is a collaboration of many partners. It is all about communities innovating with the arts and artists at the center in partnership with public health and municipalities to innovate ways to leverage the arts to advance health in those communities. So it's about weaving a national tapestry of local narratives into a national narrative. We also talk about generating a moment, leveraging a moment to generate and advance a movement, and I'll tell you about the moment in a moment. It also involves a national communication strategy that's about lifting up these local narratives and also helping the general public to recognize the connections between the arts and health, to recognize arts participation as a health behavior, and to recognize that we all have available arts and cultural resources in our communities that can advance our health. So we're about activating communities and cross-sector collaboration, amplifying those narratives, advancing health and health equity, and truly achieving transformation not only in the communities, but as an example across time of how the arts can advance health and about how important artists are in cross-sector collaboration in communities. So these communities are addressing issues, including social cohesion, well-being, and issues like youth mental health, gun violence, access to food, access to clean water, and they're doing it through all sorts of deep involvement of community members in the arts. They're building festivals and productions. They're training artists to be community health workers and artists in residence in health settings. And on July 27, 2024, all of our 18 communities that are a part of this project in the United States will engage at the same time on the same day in these big collaborative events. So there'll be this big national spectacle that we will lift up as an example of arts and health in the United States. And my job, as Dominic mentioned, has been to attempt to measure the changes in this very, very broad and expansive project. So we have a question at the heart of the entire research agenda, which is how can arts participation influence social cohesion and well-being in communities? And so we have tiny communities, small communities like Utica, Mississippi, where there are 850 residents, to the city of Chicago, Oakland, California, the Bronx, New York. So we have small communities and large. And so we've engaged a very arts-centered, multi-dimensional research, mixed methods research study. So it involves quantitative data collection, qualitative data collection, arts-based data collection in this mixed methods study. And so we mix it all together in a big pot. Some of our preliminary early findings have included in just the first of 3 data collection time points, we're in the second now, we see that increased arts participation is associated with increases in social cohesion in communities. We also see that the more people participate in the arts, the more they understand that relationship between arts participation and social cohesion and well-being. We also see disparities that persist in arts participation around geography, gender, race, and education, and things like that. So I want to share just one more thing that I'm really excited about in regard to this project, and that's how we collect data. We have worked really hard to advance equity in the ways in which researchers work with communities. So we've partnered very deeply with our communities, and we've done things like shift the ways in which we collect data. Our communities each have informed us on what is data in their communities and how can it and should it be collected in an equitable and inclusive way. So we've shifted from a very standard survey. You might, some of you, if you're researchers, recognize this Qualtrics interface. We engaged extraordinary artists, Nisma Zaman and Derek Chung from the Guggenheim Museum and Google, respectively, to design an artified and gamified mobile web application for surveying. So we have a long, complex survey that we use this survey interface for. You can see examples, screenshots from that survey here. It's actually animated, so this whole thing moves and moves you through the survey. We've also created, and I invite you to scan this QR code right now, and you can see our short survey in action. If you're not a US resident, please use 99990 as the zip code, so we know it's just test data, and we won't include it in our analysis. But this short 4-question with 6 demographic questions survey is designed as a part of our research agenda to be more like polling, and you'll see that when you see the questions. We intended to generate data that can fuel communities in garnering policy changes and investment in the arts in their communities. So for example, in our 1-month piloting period, which just concluded on Friday, as of this morning, we have closer to 500 participants. Friday, when I pulled down the data, we had 471 participants. 97% of people agree that arts participation builds social cohesion in their communities. 93% agree that arts participation improves well-being. And 94% want to participate more in the arts to support their well-being. So that's the kind of data we hope that communities can use to garner investment in the arts and ultimately to enhance access to the arts for everyone in their communities to build health and social cohesion and well-being. So I invite you to visit the Arts for Everybody website to learn more about the project. Take the survey, let me know what you think. And this is also a platform that we've used to give. We hope that others, all of you, will be able to use this interface in the future. Thank you so much. Daisy.
Thanks, Jill. So having heard about those hyperlocal projects that are being used to extrapolate upwards and make these broader generalizable comments, I also want to talk about the reverse from that. So the hypernational, how we can use data at population levels globally to understand more about the impact of the arts. Now, you heard about one of our studies in the opening comments of this session where we looked at the longitudinal relationship between arts and cultural engagement and longevity. And of course, as you heard, we did really take account in this of the various demographic, social, behavioral, and health-related confounders that could explain a relationship. We were looking to see if there was still an independent association, even when you've taken account of those. And over the last 7 years, we've actually published nearly 100 papers using epidemiological statistical approaches to look at the long-term public health impact of arts engagements. These are using the same data sets, the same statistics, and the same methodologies that are used to look at other health behaviors like physical activity and like smoking and like diet. I just wanted to give you a flavor of this today to show what can be done when we use these results at scale, particularly because what we've been doing increasingly is looking at this at a multinational level. So our papers have included looking at the relationship between the arts and the prevention, so risk reduction of developing mental and physical illness, as well as looking at how the arts are linked in with behaviors that we know are risk factors themselves. What's really exciting about this is even when we look at lots of different countries, this relationship seems to be persisting cross-culturally. In this analysis that we published in the journal Nature Medicine last year, we used data from nearly 100,000 people from 16 different countries across 3 continents. And we followed them up repeatedly over the span of 8 years. These were all random samples of the population, so they weren't people who like the arts or think this research is beneficial. They'd been randomly postcode sampled in order to be part of these major cohort studies. And they're richly phenotyped. In other words, we have very rich data on their backgrounds and their behaviors outside of the arts. And what we found in this is that when we look at these results, the relationship between increasing your arts engagement over time, we then found that there were subsequent decreases in depressive symptoms. And we found this as well with well-being measures. And as you'll see, we then meta-analysed our own findings, showing that overall in that red box at the bottom, people who engage more in the arts do have these better mental health outcomes. Now, this should be a success story. At a global level, engaging in the arts has these longitudinal health benefits. But there's a major elephant in the room, and that's that creative engagement is unequal across societies. Even within this paper, we looked specifically in the paper at creative hobbies, and we found that there was a massive difference in the prevalence of having a creative hobby across these countries. So random samples, but we found in some countries only around 1 in 2 people said they had a hobby, whereas in other countries it was 96%. And this is really problematic because actually we find that when you look at who has these hobbies, there are inequalities. The people who are the most likely to have hobbies are already the ones who are of higher socioeconomic status or healthier, for example. And this is across lots of art forms that we find this pattern. And we even see it at a national level. Countries that have higher level of social inequalities as a whole country have a lower prevalence of engagement in creative activities. And this is really concerning. One of the reasons this is concerning is that we actually find that creative activities have even more benefits for societies when they are more prevalent at a whole population level. It's not just about you engaging in the arts, but you want everybody around you to engage. When we think about outcomes like social cohesion, that makes sense. It's not just if I do arts and experience the benefits, I need all of you to do it as well so that I can experience that cohesive benefit with you. So this is something that we have to be tackling, not just thinking what are the health benefits and the societal benefits of arts engagement, but how can we make sure this engagement is for all within countries and globally. And this really brings me to what I think is the most exciting point, which is that the arts can address so many different aspects of our health because they can tackle so many different mechanisms that link to health outcomes. In a paper in the Lancet Psychiatry, we tracked over 600 different mechanisms that are affected by arts engagement, including psychological processes, biological processes, social and behavioural processes. And these operate at individual levels, so within each of us individually, but they also operate at these societal meso and macro levels. So this is what's really exciting from this top-down population level approach, is seeing that we can pick up on the impact that the arts can have even at this scale, as well as what we're seeing triangulating up from the hyperlocal initiatives like Jill has described. Thank you.
Thank you so much. I hope that gives you a sense of the extraordinary research that is being done, well, at least in 2 parts of the world, although Daisy's project is certainly covering a wide span, hypernational. And over this past year, we've engaged over 80 research partners in a number of different projects, and the numbers are much bigger than that when you think about all of the different communities engaged. We've covered a couple of them. The one that I'm going to zoom in on now is the Lancet series, the Lancet Global series, a series that brings together over 50-some researchers, some right here from Trinity College Dublin, Brian Lawler, Augustin Ibanez, and Dominic is part of our photo essay. We'll be speaking about that in just a moment. We have Martina DeWitt and Rainbow Ho, Tessa Brinza, Niels Fichte, and many others who are going to be joining us throughout the week. So as Stephen had mentioned, the Lancet series was announced last year in September during the UN General Assembly side event at Carnegie Hall. This is Sir Jeremy Farrar, Chief Scientist for the WHO, who is celebrating the opportunity that we have in this series to be able to think about the relationships between arts and health, here positioned as arts and science. There's a conversation we can have about that binary, and that's exactly the space that we're trying to address and close. And here are some of the researchers who are leading the papers who will be, that will be ideally a part of this series. Of course, that's all pending peer review. Now, you're going to be hearing a lot more about these series on Wednesday if you're able to join us again. Then we'll be having a panel with a number of these paper leads so that we'll do a deeper dive then. I'll just give you a brief sneak preview. So in the beginning, we hope to begin with a framework paper that we've been working on. A team's been working on articulating this framework for understanding the core assumptions behind why we would go about uniting the arts and health, to get into mechanisms of action like Daisy was speaking about, and by already starting to tackle the challenge of working across disciplinary frameworks from epidemiology, psychology, creative arts therapies, and so on. How do we understand the mechanisms of action, the therapeutic factors at play in terms of how the arts contribute to health and well-being, as well as what are some of the bigger picture questions that we need to be asking? What are, for example, what is the role of the artist in society? Why arts? Why are we thinking about the arts when we think about health and well-being? What does a holistic reimagining of health and health systems look like? Artists make things up. This is something Dominic had posted in the lead up to Creative Brain Week. Sometimes artists make things up, and sometimes we make up the world. And that is what we are trying to do here in this space as well. In the second paper, or in the second two papers rather, we'll tackle the ways in which engaging in the arts can lower the risks of developing NCDs. So we're focusing in on non-communicable diseases, including brain health concerns, because of course this affects, according to the WHO, over 74% of the population. Some 80%, upwards of 80%, die prematurely, predominantly from lower and middle income countries. So we're tackling NCDs in papers 2 and 3, looking at the role of the arts in lowering those risks of developing NCDs. And in the third paper, looking at treatment and management approaches when engaging in the arts with therapeutic intent or the creative arts therapies. In the fourth paper, looking again a bit at the kind of research that Daisy was speaking about. It's an analysis of 8 national population-based data sets for older adults who identify consistent and country-specific enablers and barriers to day-to-day arts engagement, and to inform global policies towards ensuring that the health benefits of arts engagement are accessible to everyone, no matter who they are or where they live, a bit like what Jill's project is getting at. And then we will, for the first time, I believe, in the Lancet's history, include a photo essay to be able to visualize the relationships between the arts and health. And some of the photographs that I have been skipping over so very quickly, not without great respect, are going to be spoken about in more detail on Wednesday. But I'm going to pass it over to the photo essay lead, Stephen, just to say a little bit more about the photo essay, because it is a rather unique opportunity within the Lancet.
Yeah, as Nisha said, it's kind of a unique opportunity. It's a great privilege that the Lancet agreed to include a photo essay. Sometimes artists feel like imposters in the world of research, but actually, as Jill pointed out with the app, the arts community and arts practitioners, I think they have an enormous opportunity to collaborate with and enhance and translate research, which, from what I see, is not happening as much as it should. So the structure of how we're doing this is there are 8 curators supported by Nils and Nisha, who are the paper leads. Each curator is going through their network. They have different geographic and health and arts specialisms. So there will be maybe 20 photos each. Those will then be synthesized into just 20 photographs, which will then form this online photo essay. But for me, I think there's something much more interesting happening, and it goes back to actually Daisy and Nils's comment, which is that researchers are often looking for images and looking for illustrations to enhance their papers. And I think that with the larger pool of photographs that we're gathering, we hope to sort of enhance the other papers, the other 4 papers. The kinds of photographs that we're looking for is sometimes art projects in themselves. This is back from the 80s, but this is one of the most powerful arts advocacy projects that we've come across, the AIDS quilt that many of you might remember, where the American government were not acting on AIDS, they were not releasing funding, and an enormous creative expression in the form of thousands of quilts were placed in front of the Capitol building, and then it was Nancy Reagan, the wife, and actually Elizabeth Taylor with some star power, but it was really this spectacle that turned the tide, and the American government began to invest. And this photograph in particular, which shows not just these couples, but it shows the artwork on the mall. Again, sometimes an artwork in itself. This is an artist-physician who lives on the Navajo Nation in the Western United States. Navajo Nation has some of the highest levels of diabetes in the United States. It's actually one of the richest land areas in terms of minerals and resources, but all of that is extracted out, and it has such low access to water. It has uranium poisoning into the community. And so what Chip Thomas does is he actually reflects and enhances and tries to build up the community. He also does healthcare messaging. Sometimes it's recording an arts and health workshop. This is just a record of a workshop and capturing the joy of people experimenting. These are just some examples. This was a donation by Tate Liverpool celebrating healthcare workers after the pandemic that was then donated to a hospital. And then we have some challenges, like this is a project that I particularly love, which is poetry on prescription. But how do you capture that on in a photograph? So we're just at the beginning of this, but hopefully we can gather and support the amazing research that the researchers are doing. We've gone way over time. Thank you.
So we're going to end here, but Brian, you did send us this photo, I think. And was it you? No? All right, well, never mind. Sorry, it's all good. Okay. It had to do, though, with health professionals sort of putting themselves in a playful position. Oh, it's Pierluigi. Okay, he'll be joining us this week. Thank you for letting us drag on a little bit more, Dominic, and thank you so much for the song and for your kind attention.